it's Dr. Katwa here, and I want to tell you something today about a test that we do in the lab called a full hemogram test. In some cases, it's called a complete blood count test. And you wonder, why is the doctor testing this? Why do you have to draw blood? This test is usually done for many reasons, but the most common reasons is to understand whether there is an infection and to tell what type of an infection it is. Another reason is to tell the amount of red blood cells that you have in your body. So it tests for a condition called anemia. Another reason is to test for components that assist with clotting called platelets. But now, in the full hemogram test, which values are important? So the white blood cell count will tell you two important things. That is whether you have an infection or if you have high production of white blood cells, which could mean that you have a type of a cancer called leukemia, which causes that. Why do you have a high level of white blood cells during an infection? It's because white blood cells are recruited to fight the infection. It is a sign of an infection, not directly by seeing the infection, but indirectly by telling you that your body is marshalling white blood cells to fight an infection that is there. So some clues will be used to tell you which type of an infection it is. So those clues will be found in a differential count. So we have different types of white blood cells. So depending on which one is higher than which one, then you may be able to tell more or less what type of an infection you may have. Like bacterial infections will have high neutrophil count. Neutrophil is a type of white blood cell. So maybe high eosinophil count will tell you that you have a parasitic infection. Another type of high white blood cell count indicator is cancer. And in this case, you will have a very high level of white blood cells, 3, 4, even 5 times higher than that of an infection. And in that case, if you do microscopy, then you'll be able to see, the hematologist will do it. They'll be able to see the telltale signs that a cancer is there. Then they'll ask for further testing, in which case they may do a test called bone marrow aspirate. So if we go to other figures that full blood count or full hemogram shows, then we have red blood cells. So when it comes to red blood cells, the most important one is the hemoglobin level. But other figures in the red blood cells that are usually useful are another figure called hematocrit, another figure called morphology of red blood cells. As it happens, red blood cells can be fat or slim. Depending on how fat or how slim your red blood cells are, then it tells us which type of anemia you are likely to have and the cause of the anemia. So when it comes to values like platelet, it tells us whether you have high likelihood of bleeding, because platelets are the cells that stop bleeding. They are not really cells per se, but there is an argument as to whether platelets are cells or not. So when you go to a doctor and you have a full hemogram asked for, don't decline because I know you fear needles. Accept and allow the doctor to draw blood, test it, and analyze it, and give you a result as per analysis. Basically, a full hemogram is not done for no reason. Now you know. Thank you.